Hello and welcome to the IdeaCast interview series, episode number 151. My guest in this episode is Dr. Anna Lembke. Dr. Lembke is professor of psychiatry at Stanford University School of Medicine and chief of the Stanford Addiction Medicine Dual Diagnosis Clinic. As a clinician and scholar, she has published more than 100 peer-reviewed papers, book chapters, and commentary. She also has a couple of books out there, Drug Dealer MD, How Doctors Were Duped, Patients Got Hooked, and Why It's So Hard to Stop, and also Dopamine Nation. And I was very grateful to receive Dr. Lembke as a guest and host her. And I tried to ask some novel questions and some questions that move out a little bit from psychiatry and neuroscience. And she was a very good sport in that regard. And I'm deeply grateful to her for allowing me to move around a little bit and ask some questions, again, from a kind of folksy, intuitive position, which is mine. And I hope you enjoy this conversation. Thank you so much for being here, and especially to the subscribers. I appreciate you all very much. And I'd like to welcome Dr. Anna Lembke to the IdeaCast interview series. I'm thrilled to have her as a guest. In my researching, she is a prolific provider of her work and information out there in the social commons, and I'm just really excited to be part of the creation process to get your work out. So welcome, Dr. Lembke. So glad to have you here.
Well, thank you. Thanks for inviting me.
Yeah, and to the audience, what I would like to say, or maybe a way to set up some context here, is I'll start with a few kind of questions that closely relate to Dr. Lembke's work, and then we might move out into some other areas and maybe explore some new terrain together in this conversation. So, and welcome, by the way, to my subscribers and anyone else who happens to come in for this conversation. So let's get underway, Dr. Lembke. And in asking you some more straightforward neuroscience and psychiatry questions, one thing that kind of, and this might be me just being nitpicky, is the idea of addiction in a medical perspective is treated as a disease, and that's the sort of disease model, I guess, that it's commonly referred to. This may be a semantic nitpicking, but I'm wondering, like, disorder and disease, and if you abstract the disease out of psychiatry more into psychology, do you see overlap in disorder and disease? And I'll acknowledge that disease, can specifically diagnose and specifically point to pathologies and things like that, whereas a disorder may be more ambiguous. So, do you see that having overlap or complementarity? And do you have any criticisms of either? Because I've listened to psychologists who will say, well, it's more of a disorder. And So what's your take on that? Where do you land on that?
Yeah, well, I mean, it's an interesting question. To be honest, I haven't given that much thought to the difference between a disease and a disorder. I mean, reading between the lines, it sounds like disorder refers to a pathological process that maybe we don't know what the underlying biology is, whereas disease, we claim to know what the underlying biology is. I mean, I think for most mental illnesses, we really don't know too much about the underlying biology, but when it comes to addiction, I think we know more than with other mental health or psychiatric disorders, because the animal models are so much more robust than we have for other mental health disorders. Sorry.
No, I'm sorry. Go ahead.
No, I'll also just interject that, like, the disease model of addiction is also the right model for sociological and anthropological reasons. So not just because there are these neurophysiologic changes, which are pretty robustly identified in the science world, but also because addiction has for so long been left outside of the house of medicine, considered a moral problem, an issue of, a social problem. And those things can also be true, right? But I think this embracing of the disease model is really an embracing of the idea of like bringing it into the house of medicine and saying, hey, this is also a psychiatric disorder. And it has biological brain changes that are well documented that are associated with it. So we have to embrace this disease model, because otherwise people are not going to get treatment. It's going to remain stigmatized. We're not going to have research dollars dedicated to it. We're not going to have, healthcare providers trained in how to treat it. So that's the other piece of this.
Okay. And part of my motive for asking was, again, listening to psychologists lensing it perspectively from a different direction, is seeing the constellation of potential presentations or manifestations of that mental illness as addiction, so that the complexity and the background of addiction, like you're saying, and I think this is absolutely appropriate for psychiatry and neuroscience to be rigorous in that regard. But I was wondering if we abstract out a little bit into the domain of psychology, and this is, and again, this could be a very nitpicky question, but I just wanted to get your tuppence on that.
No, I mean, these are important. I think these are important questions. Is it really a brain disease? And here, and I've often argued for a more holistic approach, the biopsychosocial model. And yet then here I am talking in a very reductionistic way about addiction. That definitely seems at odds. So I think it's very reasonable to ask me, how do you reconcile those things? And I reconcile it in part from like a historiological, sociological perspective, that just like, hey, if we're going to count all these other things, depression, anxiety, schizophrenia, bipolar disorder, PTSD, as mental health disorders, then surely we must embrace the overwhelming evidence that addiction too is a mental health disorder. And what people don't realize, perhaps, is that for like the last 250 years, we haven't done that with addiction. It's been basically excluded from our sort of compendium of disorders or diseases or whatever you want to call it.
Right. And there's sense in that when you lens it historically. I mean, it has similar tracks perhaps with crime and mental health and things like that, where it was a moral failing that you were, schizophrenic, 100 years ago, and that you were doing weird things, and they'd lock you up, So I get where we're evolving in that sense. So, well, thank you for answering that question for me, because that's something that popped up on my radar this afternoon when I was wrapping up my notes and stuff. Okay. How much stock do you put in the Big Five, the ocean, or the canoe scale? That's part A of the question. And then I guess part B of the question is, has there been any studies or research done in how, if someone comes to you and they're in the throes of addiction, or they're really struggling, can you even evaluate using those kind of criteria? And is there a change when someone has tilted the seesaw, or righted the seesaw? Is there any effect or use in looking at someone through that lens? Because I know, again, if somebody's presenting a lot of things with the addictive addiction condition that they have, that they might be a different person. And so I was wondering if anybody's ever paid attention to that, or.
Okay, I'm not sure what the ocean scale is, so you have to sort of
okay.
walk
I
me
don't
through.
know if I don't know if that's psychology or if it's sociology.
Probably
but
yeah, I don't know.
Okay, so it's canoe or ocean, and it's openness to new experience, neuroticism, high or low.
This is the Big Five, the Big Five personality
the Big Five
traits.
marker,
Okay.
right. So
Okay.
they call them ocean or canoe and stuff. So
Yeah.
anyway.
Interesting. Okay. Yeah. I mean, it's funny so far in this conversation. I'm very much in the world of psychiatry and addiction medicine. I hear that you're like very much in the world of psychology and maybe philosophy too. So I guess your question is, I guess I kind of already answered it. Like, we don't really look much at the Big Five, when it's not that we don't care about personality structure. We do, but I think, people with very different personalities, all kinds of people can get addicted, rich, poor, young, old, ocean, canoe. I think we've probably seen it all.
Yeah, and I'll apologize in advance in the totality of my asking questions, because they are more, again, from the vein of philosophy or psychology or cognitive science. But but I'm looking maybe for convergence there with the more rigorous, the language and the ideas that you guys use in neuroscience and psychiatry. So if we land on something and it
so there is,
up.
I mean, I am aware of, some convergence there. So for example, people come into this world with different risk factors for addiction. Some of those risk factors are inborn or innate, others are acquired, and many risk factors are contextual or environmental. Okay. But when we look at personality traits, we do know that people who are more impulsive, that is to say, who have some difficulty pressing the pause button between the thought or desire to do something and actually doing it, which is how we define impulsivity. People who are more impulsive that's a pretty stable personality trait. And that is associated with higher risk of developing addiction. Also, little kids who are more vulnerable to emotion dysregulation. That's also been associated with a higher risk of addiction. We also have a bunch of co-occurring mental illnesses like attention deficit disorder, which is associated with higher risk of developing addiction in adulthood, as well as many other mental illnesses, bipolar disorder, schizophrenia. So it's not exactly like the personality spectrum, but just to emphasize that if you have a mental illness, you are at higher risk for developing an addiction later in life.
Okay. Let's just do a theoretical patient here and coming into your practice to step back perhaps a little bit from the big five or the scales or any of that and to speak to a noticeable or something discernible personality change. I suspect that that's part and parcel of the recovery process is that somebody, comes to you, presents X, Y, and Z, and through, and this is something I really loved about researching you is that fasting and the 28 days or 30 days of abstinence, and, you get these really seemingly miraculous resets where somebody is presenting depression with the addiction, and like kind of almost like a comorbidity, but then when they come out on the other end, they're not dealing with the depression perhaps in the way they were prior, or it's been alleviated. So I guess that's a confirmation maybe that the personality perhaps conveys with with those pathologies being moderated or remediated or whatever the right term might be.
Well, addiction is the great mimic. And when people are in their addiction, they can look like they have many other mental health disorders, which they don't really have. And we know that because when they get into recovery, those signs and symptoms go away. Now, many of people also have co-occurring psychiatric disorders. So, but even the ones who have a co-occurring psychiatric disorder, it will get much, much better when they get into recovery from their addiction. And personality disorders, in particular, which, as you know, is a continued maladaptive interpersonal style that leads to significant impairment in that person's life. And we have these different clusters of personality disorders. The most commonly known ones are cluster B. This is like a narcissistic personality disorder or borderline personality disorder. They have certain characteristics that go with those personality disorders. And what you will see is that when people are in their addiction, so actively using their drug of choice, they can look very personality disordered, very narcissistic, very borderline. But when they get into recovery, those symptoms of personality disorder can largely disappear. Doesn't mean, they go away in every case or they entirely go away in every case, but it is really remarkable to see how much less personality disordered people appear when they get into recovery. I even just thinking of a patient right now who is in recovery, that is to say, not using nitrous oxide, which is her drug of choice, for about 2 or 3 years. And she's just a remarkable person in recovery. She's bright, she's engaged, she's charming, she's conscientious, she's kind. Very sadly, she relapsed in the last couple of months, and she's very, very borderline acting in terms of, personality pathology. If you didn't know better, you would just think she had a personality disorder, but really it's her nitrous oxide addiction that's driving that.
Okay. This might be a good time to insert this question. Mark Lewis is a psychologist and a neuroscience person, and one thing that taking away from his work and the work of others is the idea of the reciprocal narrowing in a sort of lensing of the world, and the patient you just described. Do you find that, and this is a metaphor, I guess, the reciprocal narrowing, that your once open focus and sensory motor loop interaction with the world and so forth becomes very convergent down into the aperture is very narrow. Is that a good metaphor to work with these kind of things where that which may matter to someone who's not dealing with substance use disorder and addiction can be very difficult for someone to extricate themselves by way of that aperture closing?
Yeah, well, that's a neat metaphor. I have not heard that before, but what I teach my medical students and residents is that the hallmark of every mental illness, not just addiction, but every mental illness, is self-absorption. Self-absorption is distinct from selfishness. Selfishness has a moral value that we think the person selfishly only cares about themselves. Self-absorption is something different. It's the inability to think of anything but oneself. And people with severe mental illness are almost universally self-absorbed because they're trying to survive, right? I mean, they just figuring out what the heck their own minds are doing is taking up so much of their cognitive and emotional energy that they can't do otherwise but be self-absorbed. And when people get into recovery from any mental illness, what you see is this turning outward and an ability to stop thinking about themselves 24/7 and to begin thinking about other people, the world, nature, creative tasks, whatever it may be. Addiction is sort of a unique subset of that sort of solipsistic turn inward because, when people are addicted, they also have a very narrowing of their focus on their drug of choice. So it becomes, in many ways, the vehicle through which they organize their lived time. It's almost, in an odd way, with the way that they escape self. It's very self-absorbed, but it's all focused or projected onto getting the drug, using the drug, coming down, hiding use, and getting some more.
I have a question that's kind of, I guess, pharmacological in nature, but it relates to some of the things that I took away from your interviews and conversations. And that is that typically, at least in the commons and the general audience perspective, SSRIs and SNRIs are prescribed for depression. And as you've noted, in with regard to addiction, that depression can also manifest or present. And what happens when somebody is in that dopamine seesaw? And to the audience, I'll link some conversations that Dr. Lembke has done, and if you haven't been introduced to her work, and you can understand what this question is based on. Is that a problem when SSRIs or SNRIs are prescribed, and it's more of that addiction dopamine issue? Does the serotonin conflict with that, or is there something going on there that makes things worse or not better? I don't know.
Yeah, so it's a great question. It's a complicated answer. It's multi-layered. I guess I'll start by saying that like the SSRIs and the SNRIs are medications for depression and anxiety. And we typically, so they're not scheduled drugs. The scheduled drugs are a subclass of prescription drugs that are thought to have addictive potential or be addictive. And they're not, the SSRIs and the SNRIs are not scheduled. So we do not think of them as addictive, which means we do not think of them as something that people can experience withdrawal from or develop tolerance to. Tolerance means needing more of a drug over time. to get the same effect, or finding that the drug stops working at a current dose. But although they're not classified as addictive, the truth of the matter is that we do have patients who experience tolerance on antidepressants, which means that it works for a while and then stops working and that they need more. We also have patients who experience withdrawal when they try to stop the SSRIs or the SNRIs. We don't call it withdrawal, we call it a discontinuation syndrome. I think, that's kind of a splitting of hairs that's sort of, I don't know that we could talk about why that is, but but the bottom line is that it's very clear that anytime you're kind of messing with this hedonic or, pleasure pain pathway, you're going to get some degree of neuroadaptation to whatever it is that you're ingesting, such that over time, you're going to need more of whatever it is to get the same effect. And for some people, that may be on the order of decades, so that it never really, practically speaking, becomes a problem. And for others, it may really be on the order of days to weeks, in which case that's a problem, because we can't continually go up to try to meet that need. So the other thing I would say in response to your multi-layered question is that we've also seen patients who do misuse and get addicted to various antidepressants, crush and snort them, or just take, binge and hoard and binge them. It's also true that we have patients who have what we call like the frontal lobe syndrome, where they feel a dampening or a deadening of their emotional range when they get on these drugs, which would seem to suggest that somehow there's a loss of joy or the capacity for intense feelings with the serotonin modulators. If we can modulate them on like the anxiety, depression end of things, that's good. But if we overdo it and they can't cry when they have a parent die or something like that, then that's not so good. There's also neuroscience showing that in the nucleus accumbens anyway, serotonin and dopamine actually work in opposite directions. That dopamine is your sort of go, explore, approach neurotransmitter, and serotonin is very specifically your stop, retreat, and avoid neurotransmitter. And that, at certain sites in the reward pathway, as dopamine goes up, for a given stimulus, serotonin goes down, right? So that then they're working synergistically to get the organism to try to approach whatever that stimulus is, which is deemed necessary or important for survival. Or likewise, when you don't get that dopamine release, but instead you get this, surge of serotonin, especially in a pathway that goes from the raphe nucleus to the prefrontal cortex, that's a whole lot of like avoid, 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 retreat, 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 dangers coming your way kind of thing. And that's serotonin mediated.
Okay. All right. Thank you for answering that. Now, if you're comfortable with this, I'd like to ask a question of all the addictions that you've spoken to. I'd like to go into social media, the internet, and if we could turn our imaginations on, maybe you and I are in front of a room full of 16-year-olds who are digital natives, who are fully immersed. You and I are pretty much the same age. We came up in a time. Yeah, I remember when. Yeah, the pocket calculator was really heavy tech.
Right. So, or when you turned on the TV and there were just these rainbow stripes, like the vertical rainbow stripes, right. And then there was like no shows.
Yeah, I remember. So we have a room full of 16-year-olds, and I want to maybe open up the idea of I want to orbit around the work that you do, but I also want to import a couple of ideas that hopefully I can pull this off and it all comes together where you can lend your wisdom to these. I know you will. It's just I hope I don't, wobble this.
I'm not sure how I'm doing so far here. So.
Oh, no, you're great. And I apologize. I didn't have psychiatry questions necessarily. I wanted to move you around.
No, it's good. It's very interesting. Sometimes it's like all the blind man, the elephant. It is interesting to talk to somebody who's from a different discipline and realize that we have different language. It's just a good reminder how different our language is we're so siloed in a funny kind of way.
That's
Or at least
true.
I
That's
am.
true.
Maybe other people are.
Well, there's probably those people that go around and they oscillate and so forth, and good for
Yeah.
them. But you have to focus on what you do, and you are specialized, and that requires that attention, that convergent focus. Yeah. So and to disclose and disclaim, I am a layperson, general audience. It's just I've had really good guests who are in academia, and but they may be cog sci or psych professors and people like that. So everything the font of where I'm my questions are arising is these people, and my parroting their wisdom and trying to convey it out to provide a stimulating conversation or an interesting conversation. So just to confess, I'm nobody. I'm just but I love that because what we're doing here is we're building a bridge, and you've done this to great effect with your interviews and your conversations. Is that you make everything general audience friendly and approachable, even though neuroscience and psychiatry can go way off the rails in terms of technical jargon and complexity and all of that. So again, to you, I say thank you for having these conversations. So to get to our audience of 16-year-olds and social media and what's going on with them and what's going on with social media and addiction is in the room, but I also want to bring in this concept that's always fascinated me. It comes from media theory and social systems theory, and I'll reference Hans-Georg Moeller, who's a professor in Macau, China, and he works with a lot of this. And you even mention it in after school, you do those wonderful animated talks, and you mentioned Winnicott and the false self. So this is close. This is adjacent, what you referenced there. And that is the idea of the prophilic self, the avatar self, the curation of a self on social media, and the second order observer versus a first order observer. I could get into all kinds of crazy stuff about the way those people like Nicolas Luhmann and Guy Debord and all them, blah, 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 they talk about these things. But to get to a point as quickly as possible, that what I'm intuiting in this audience of 16-year-olds is that they, let's say mind one, mind two being kind of like the Freudian superego or the persona or something that's out there and it's in the world and it's performing and it's selving and doing all these things. But there seems to be this other third mind that's in the social media commons, and it's with TikTok and Snapchat and all these other things, and it is exposed to the reward mechanisms. It's exposed to the violence of trolling and all these different things. Now, to get back to psychiatry and addiction, what I'm wondering in the complexification of another self of beyond this this persona that all of us have. How would you intuit? And maybe don't answer as a psychiatrist, but maybe how would you intuit as a caring person who is well informed that what's going on with the mind of that 16-year-old who's not only addicted to being online, but is also out there as this extended self, this kind of I don't know. If that's not too foggy or ambiguous. Did that question make sense? Like
Yeah.
that there is
Yeah.
vulnerability in that
Mhm.
othering into the social media commons.
Yeah. Yeah. Okay. Well, so as I understand what you're saying, we have sort of our identity, right? I think you used the word ego, or probably ego,
Yeah.
I think, and not probably not super ego, but ego.
Yeah.
And then we have our online identity, right?
Yes. Yes.
Okay. And you're wondering you're asking me, what is the relationship between our identity, our online identity, or our avatar, online persona, which may or may not resemble our offline identity at all, and then social media addiction. Is that kind of?
Yes, and given the proliferation of social media, that there is contingency in that other persona, the extended self into the social media ecosystem, so that there is your Snapchat self, there's this self, there's the other self, and to me, as somebody who is not a digital native, not I mean, I present myself perhaps differently on Facebook. I'm old, so Facebook or whatever I do, but I'm just trying to embody this idea of you know they don't know a difference for not putting themselves into the avatar self or the prophilic self into that ecosystem, and the reward and the injury that can occur psychically, that's then fed back into the persona that then may be housed in mind one, or the underlying consciousness. And to say superego earlier was more maybe this projected self. It is that public self, very broadly. So I hope that's
yeah.
good.
Yeah. No, that's great. So, I mean,
Okay.
this is a very, very interesting topic. I mean, I guess I would begin by saying that I think that we define the self based on our interactions with other people or other entities, right? Including now AI entities. I mean, that is how we come to shape and understand the self. And it's these iterative interactions that lead to the conclusions that we make about who we are and who we are in the world and what we need and want and care about it and all of that. And there's no doubt that the average 16-year-old, 50% of whom are now spending all of their waking hours online. That's the latest Pew research, that approximately 50% of teenagers are continuously online. Take that in for a second. That's huge. That means that this extended self, or this avatar self, this self that exists in the online ecosystem, is the self. It is the self, and that there's less and less awareness of a self separate from that. Plus, all the peers, or most of the peers, since 95+% of teenagers are at least spending part of the time online, that is where interactions, the majority of interactions, are now occurring. So, I mean, this is a remarkable transformation, right? It means that we are existing, or teenagers are existing, most of them, and defining and identifying the self and their social network in a virtual space, and that virtual space takes strong precedence over any offline spaces for more and more teenagers. And then we have to very carefully and honestly evaluate that online space. And what is true about that online space is that it has been drugified. And what I mean by drugified is that it has been turned into a very potent drug. Not the content per se, but the medium itself. And what makes something a drug? Well, access is one of the biggest risk factors for addiction. If you very simply have access to a drug, you're more likely to get addicted to it. Potency, how reinforcing or pleasurable or potent it is, how quickly it acts. Novelty, how quickly it can change in response to our tolerance or our boredom with the same stimulus. Quantity, the more we expose our brains to a drug, the more we change our brains, the more likely we are to get addicted. And then, of course, uncertainty, the ephemeral nature, the mystery of the algorithm, the slot machine effect, because we know that drugs that are more uncertain and less predictable are actually more reinforcing. That is, we're more likely to do the work to get the drug, which is sort of the definition of addiction, like how hard are you willing to work to get the drug? So we now have a medium, right, which is inherently addictive, engineered to be addictive, has all of these addictive drugified qualities. And this is now where, we are spending our time. So to me, the implications of that are profound, because we have the illusion that we are making human connections. But in fact, what's probably happening is that we're just stimulating our reward pathway, or what may start out as the intention of a human connection ultimately gets usurped by the reinforcing action perception loop that is inherent in the medium. And there are so many, which means that ultimately we're clicking and swiping and spending more and more time online, not because we're building relationships or coming to know ourselves in meaningful ways or finding meaning and purpose, or even frankly learning, right? Because there is this illusion of sort of, well, I'm watching an educational video, I'm learning. It's really, you're right, right.
Guilty. Yeah,
Yeah,
sorry.
right. But I mean, it's not that learning never happens. It's not that
Hmm.
socialization never happens. It's not that connection never happens. There's good and bad, but
Right.
we really have to be very aware of the ways in which the medium itself, which is drugified. I mean, it is a slot machine, can very quickly take over whatever our initial or early intentions were for engaging in the use. And I think, evidence of that, I mean, there's so much evidence of that, but, where young people and people in general are spending much of their time online is actually passively consuming content generated by other people. So, what started out as like, oh, we can communicate, at a distance, and we can share emails or texts or photos from our friends and family or this event, is now I'm just basically consuming reels on Instagram because it's incredibly reinforcing, distracting, numbing, escaping. And now that you introduce AI avatars, okay, now my own avatar in this space is now interacting with another avatar that's not even a human being. So now we've just really kind of left humans behind, and it's us and, large language models embodied by incredibly, potent graphics. And now really I'm just engaging, I'm literally engaging in a kind of mental masturbation. Or worse yet, I'm experiencing mind control, right? Because now you have like an AI entity that has basically just hijacked my motivational system. I'm not now motivated to do anything but just spend time with this, highly addictive entity. That's a really bleak and scary future right there. Now, I'm not saying that that's the road that everybody goes down, but that's certainly a very significant risk, I think, that the human population is facing.
Yeah. One of the CogSci psych people I follow, he's at the University of Toronto, and he calls the AI as sort of parasitic processing or parasitic attachment. And as I think you just described, and that I don't think we're aware of that necessarily, or not explicitly.
Right.
Yeah.
Yes. I mean, the other piece of this, which I find really fascinating, are, what's called parasocial relationships. And parasocial relationships are where they're relationships that are one-sided. So, where we, for example, go online and follow people who post or follow celebrities, and we watch them all the time and watch their videos. And then we have this sense that we have a personal relationship with them. But obviously they don't know us, right? So then it's very one-sided, right? But now we've invested all this time and all this energy, and it feels like a friendship to us, but it's not a friendship. It's not a friendship, right?
Yeah.
But we feel like we're in companion with this person. They're not our companion. But the illusion of having this companion, I mean, it's amazing. It's so instant and powerful, these kind of parasocial relationships, but they're not truly reciprocal in any meaningful way.
Yeah. Yeah. No, I see that. Let me try to bring an isomorphic idea in to the consumer and the recipient of what we've been discussing, and move into the content creator themselves. So that, again, maybe we see this isomorphic relationship, that the addictive process or the addictive ensnarement occurs on the content creator side. Because if we think about social media, it is media two, whereas media one was what you and I grew up with in the 70s and the 80s, and it was all the networks pumping out well-produced, to their standards, information. And now we have this sort of anarchistic domain, or whatever you want to call it, of content production, where everybody's producing content. And I think and I have like 4 YouTube channels, so I'm in there, I'm doing it. I have 1,300 uploads on one of my channels. It's a botany and horticulture channel. This next week's my 15th anniversary, and I've done 1,300 videos. So you can see I have obsessive personality. But anyway, I'm kind of in that boat where it's like, I don't feel a tremendous amount of pressure to get likes or confirmation or validation. I respond to my favorable comments, and I usually respond favorably to trolls as best I can within moderation. But I love just cranking out new stuff, and here's a new video, and living in Florida, I have a lot of access to botany and horticulture, so it's just this ongoing thing for me. But anyway, to get down to more like what's really going on out there, we have influencers and people talking about clothing and fashion and dating and all these different things. Those content producers are themselves, I would intuit, are addicted to content production, and again, that feedback loop, the reciprocity with the other side of that isomorphic relationship with the consumer, who again, these big social systems guys would call that the general peer. It is the invisible peer that you are not intimately connected with, and may, other than comments, where there may be a handle or an avatar or something. But anyway, would you agree that that is probably part and parcel of this whole thing of addictive, highly drugified, social media, that it's creation and consumption that seem to go hand in hand in terms of we have to be real careful with becoming addicted to those things.
So I first want to say that I think that the internet is a wonderful vehicle for creativity. And I love the kind of explosion and, as you say, sort of anarchist nature in many ways of really the democratization of creativity and content production. I think that's great. And it's very, very exciting and very new. And I think that's wonderful. But I will also add that the most severe cases of social media addiction that I have seen have been in content creators themselves.
Okay.
Right. So, and as one of my patients put it, he said, like, no one was meant to get that much love. Do you know what I'm saying?
Yeah.
No one was meant to get that much love.
Right.
And it's also never enough. It's never enough because, the moment we have however many likes or views or what comments or whatever it is, if the next video doesn't top that, then we're crestfallen, right? So it's that come down from, what we hope for or expected. No matter what we get, it will ultimately never be enough. And that's going to be true for every performer and every professional, not every, but many, performers, artists, professional athletes will describe that phenomenon. Okay. And so then often what can happen is that can then lead to other drug use as a way to sort of extend the high of content creation success, or just escalate the engagement in getting more of that online love. I should also, for your listeners, just kind of define what addiction is. Addiction is the continued compulsive use of a substance or a behavior despite harm to self and or others. So it's really key that it's a very intense level of engagement that then leads to harm. And that leading to harm piece is really key to the diagnosis. So if you've got somebody who's really deeply engaged and there's no harm, then that's not an addiction. However, we're often not the best observers of when that harm happens. We may not see the harm when others do, or until it's way, way down the road of harm. But that's essentially, how we diagnose addiction, how we define and diagnose it.
Okay. We have a little under 15 minutes left. I had a couple of cog-sci questions, and I'm going to chuck them out because I want to get to something that we've analyzed and we've examined and we've launched inquiry. And now I want to, because this is something that you bring up and address with other interviews and other conversations, and that is when we have managed to manage the addiction gremlins and the dopamine gremlins, and our lives seem to be ordering themselves, and we seem to be salving ourselves in a positively valent, pro-social way. You will be asked questions about spirituality from time to time. So one thing that, and I've orbited around all kinds of spiritual stuff since I was 16 or whatever, I kind of fell away from religion and was like, what's out there, and so and that's been a lifelong inquiry. I try to orbit sort of in an agnostic way. I don't try to really latch on to anything. But so to ask you, when one finds themselves in the open space and the safer space of the freedom from whatever that addiction was, how would you counsel or guide a person navigating that ecology of practices and belief systems and fatty new religious movements and genuine bona fide well-established religions, et cetera, when one is coming out of addictive I don't want to say behavior, that's judgmental, but whatever it is, it's the patterning and the selving that was addictive. And I say selving as though we are fluid in our self-making and not necessarily this reified, concrete, solid self. What advice would you give to someone who's just sort of starting out on a spiritual journey, but you want to make sure that you're not going to fall into traps where the addictive thing might be? So in other words, you're getting hits and rewards. Because I've been to meditation conferences where, Jesus, it's like oxytocin, dopamine overload, hug and happy and all that kind of stuff. So I'll shut up. What do you think is a good way to start your journey as a recovering person who is selving their way in the waymaking in the world, and not getting themselves into a trap or into some areas that they may not want to be in?
Yeah, it's a great question, because of course that addictive behavior, addicted tendency can transition to other things, including possibly kind of spiritual practices or gurus or certain movements or what have you. I think that the advice, I mean, this would be a much longer answer, and it's an interesting question. But I think the advice that I would give people is like from a kind of an idiom, which is to do the next right thing. And the reason that I think that's such a powerful guide for all of us, but especially in early recovery from addiction, is because, first of all, it's values-based. It says that we really can know right from wrong. And many people with severe addiction have engaged, because of their addiction, in behaviors that they knew were wrong, and they did it anyway, and they regret and have shame about. And so it's the point is that we have the capacity to know right from wrong, and we can choose right from wrong. But the truth is that we can only do that in a very short time frame, which is the very next thing that we need to be doing. And if we try to project ourselves too much in the future, we get ourselves into trouble. The other thing is that it also is a good kind of anti-narcissism type of mantra, because very often the next right thing is just like getting out of bed in the morning. Going and brushing our teeth, doing the laundry, having breakfast, going to work. And so really kind of narrowing the space of our focus and our identity, putting actions before feelings is really important. So not waiting until we feel like doing those basic, right value-based things, but doing them even when we don't feel like doing them, right? But when we know that they're the right thing to do. I think this is really core to early recovery from addiction, but also to sustained recovery, a kind of narrowing down to the immediacy of the moment, values-based, engaging our attention and discernment. What is the right thing to do here? I have the capacity to know what that is. I can choose the right thing. And I cannot and should not expect that as soon as I choose that right thing that I'm going to feel better. I probably won't. But it's the accumulation over, days to weeks to months to years that is really the antidote to the addiction, life or the sort of maladaptive coping that can ensnare us.
Okay. That was a beautiful answer. Thank you. One amendment to that, and
Yeah.
when you said the next right thing, there's this really curmudgeony, cranky old Welshman, and his name's Dave Snowden. He's a systems complexity scientist. So it's normally very dry intellectual stuff. But once in a while he'll pull out zingers. And so one zinger he pulled out recently in the last couple of years was he was referencing Frozen 2.
Yeah.
And there's that
Yeah.
one, I haven't seen this, but there's a princess who doesn't have powers apparently. And she sings this song and it's like, I can only do the next right thing or something
Yep.
like that.
It's
And
called,
Dave
the song is
Snowden,
called Do the Next Right Thing. Yeah.
thank you. Yeah, I thought of that immediately. Well, not it's
But it
vicariously
didn't
through Dave.
originate with Frozen, right? It goes back,
Right. Oh,
you
yeah. There's
know, hundreds of years, and
yeah,
there's a poem that was written in the like 1800s or something.
yeah.
And of course, it's become, very embedded in the 12-step philosophy too, right? Like do the
Oh,
next right thing is core to the 12-step traditions.
okay. Yeah, Disney loves to co-opt hermeneutics and didacts from the old days, and that's great because they have capture and they have an attention economy like no, well, they've been
Yeah.
sharing it with a lot of people, but yeah, to speak to their good faith in doing that, yeah, here's to more of that, and they make a profit too, but that's okay, hopefully for them. We're coming really close, so let me do this. If there's something we didn't discuss in this conversation,
Wait, but what
that you
did
would
the
like to,
Snowden guy say? What did the Snowden guy say
well,
about
he
it?
referenced that
Okay.
verse that I can only do the next right thing, but it
Okay.
comes from he has it's called Cynefin, I think, if I'm saying it. It's a Welsh, that none of us can pronounce, Anglophones can pronounce, but it's the Cynefin, and he uses a lot of neat metaphors like the marsh tidal metaphor and things like that for systems complexity and for sense making in that domain. And he usually speaks to tech firms and companies that management strategies and organization and things like that. But he's also at systems complexity as lens through um, the psychosocial commons and the psychosocial psycho-emotional domain. There's connections there that I like to imagine, and he butts heads with people that I like, and it's just this weird tension there that I like. So, but yeah, Dave Snowden, he's an interesting guy. A lot of the lectures are the same because he's hired as a consultant, so it's kind of repetitive. But one or two of those, and there's interest. He's like Nora Bateson. She has really warm data and the aphanopoiesis and all these weird jingly things, and just when they collaborate. So, but anyway. But to ask before we part ways on this conversation, was there something that you'd like to touch back on, or something that didn't come up, or if there's something you've always wanted to say on an interview that you just want to get out? Do you have any last thoughts or parting thoughts that you'd like to share with the audience?
I mean, nothing comes to mind.
Okay.
I've enjoyed the conversation. It's fun to get questions that are a little different or a slightly different angle than the typical questions that I'll get. So this was fun. I'm sorry you had to skip your cognitive science questions because I was looking forward to those, but
Oh,
next
well,
time.
yeah, I
Yeah,
was
no,
gonna say very
go.
briefly, they
Yeah.
correlate with everything we've talked about. But yeah, if this was a good experience and you want to come back when you have time, we can open up with that and move into that, and I'll try to come up with a raft of other good questions. But yeah, I need to let you go now. I'm so grateful to you for coming here. Mine is but a little show, and so that you spoke with me and gave me your time. I am just, again, my gratitude, because I speak again on behalf as a kind of pars pro toto of the audience, to say, thank you for your wisdom, thank you for what you do, thank you for that which you've imparted into the commons, into the information ecology, because we are living in interesting times, and in very technological times, and I think your message is important, and it's being consumed with a plum, or whatever the right word is. So thank you, Anna. I appreciate it so much
Yeah,
that you were able to speak with me tonight.
you're welcome. Thanks for having me on. This was good.
It was an honor. So I'll say goodbye to you after I stop record, but to the YouTube audience and to people who are subscribed to my channel or otherwise, thank you so much for your attention and your being here. And I hope there were good takeaways for you. And I shall endeavor to have her back as a guest on another episode. But take care in the meantime.